fitness has three parts to it currently. One is going to be folks that are coming out of cardiac and pulmonary rehab. We want to give them a life of independence so that they're able to feel more comfortable about activity and improve their life after their event. Another piece of the medical fitness program is for folks just healthy living. They want to look at more of a prevention lifestyle. They want to understand more about just the educational component. What can I do to improve my lifestyle long term? They want to prevent a heart attack. They want to prevent stroke. They want to learn to manage their diabetes. They want to prevent cancers and so forth. So that is a healthy living part of the medical fitness program, which we provide for not just employees here, but also our community.
One day I could not breathe. Then I went into emergency room in St. Francis Hospital. They said I had a microvalve tear-up. So I got admitted there. And they did the surgery. This is part of the surgery recovery time recommended by doctors. So it's almost 2 months I had my surgery. This is my 3rd week of rehab program.
Had open heart surgery in March of '09. Came here for rehab and continued on. I prefer it on this side of the grass. They tell me after you go through open heart surgery, you have 2 choices. One is to exercise, and the other is to give up. I sat behind a desk for 32 years. I got very little exercise. Now this is my job. I'm capable of more strength than I thought. I'm getting wider through the shoulders, and I can play 18 holes of golf and not be exhausted.
They start with a few laps of walking, then the leg exercise, the new step, the machine behind me. This is the 3rd one. They may try, make me do something else as I progress. Otherwise, just walking and new step and bike exercise. So far, that's what I have been doing. Also, they help me with my diet plan, because I'm borderline diabetic. So my eating, glucose control by the food, good dietitian help me what to eat, what not to eat, how much you can eat. That keeps my sugar on the level so that I'm not dropping or increasing excessively. So overall, I'm gaining a lot of confidence here, and I hope by the end of this session I'll be back to normal, go back to work again.
Cardiac rehab, they don't want restenosis if they've had a stent put in, if they've had coronary artery bypass grafting. They want to make sure that they are learning healthy lifestyles to where they don't have occlusions again in blood vessels, that they're losing weight so their blood pressure is lower, they're feeling better. For folks that are trying to lose weight, exercise and proper nutrition are the 2 pillars by which they're going to see improvement. And then lastly is this. The medical fitness is set up to where folks it's cheaper for them to prevent illness than to be on the backside and try to treat the illnesses. So I think with that alone, that's most important and critical.
What brought me here was the fact that I've been a diabetic 40 years, and then that affected my heart in the last couple of years. And then right prior to that, I had kidney failure. So I'm on dialysis, also a diabetic, and I had a couple of stents put in, all that here at St. Francis facility. Well, after I had the stents put in, recently they sent me a card, said, why don't you join our heart rehab center? So I came here and they explained it to me. It was a 36-week program that I could continue even afterwards. So I started this, and they monitor everything closely. When I first came in fact, for about 4 or 5 weeks after I had the stents put in, I was kind of timid. I was afraid to raise an eyebrow. So this step-by-step program enables me to get my strength back.
The most rewarding part has got to be a life of independence. When you see an individual come in with fear, they're like a deer in headlights. They've never been in this situation before. They're afraid to bend their back. They're afraid to get the heart rate up. And you see them within 10, 12, 14 weeks, and then years down the road, you see them with a lifestyle. They're going out, they're saying, hey, this weekend I went here, I took my wife, we went on a date, we went hiking. They've done things they've never done before. They're breathing easier, they're medication, they're coming off medications. Those things are very, very important and rewarding for me as well as rewarding for them.